Thank you, Sam and Shami, for joining me on the podcast today. It's great to have you both here. We're really interested in talking about your nonprofit, San Bernardino for Rapid Recovery. But before we get into that, I wanted to talk a bit about COVID-19 and where you both feel the country, state, and our local region is at. Can you both maybe outline how you feel about COVID-19? There have been a lot of developments recently. President Biden made some rather controversial remarks yesterday. Where do you both feel we're heading? Are we heading in the right direction, or do you think a lot more work still has to be done in addressing the pandemic?
So I think, I'm sorry, Shami. Like you referenced, Biden said, I think it was either today or yesterday, the pandemic is over. I disagree with that. I mean, there's still a pandemic going on. There's still, thousands of cases occurring each day. In San Bernardino, where we operate, it's less. We're looking at around 200 cases a day. But this summer we did see it definitely wasn't as bad as previous surges, but we did see a slight surge. And my best guess, I'm no epidemiologist. I'm not a scientist or anything, but we'll most likely see a surge again this winter. Especially, just looking at in San Bernardino alone, on a local level, we're still looking at only 54% of the population has gotten fully vaccinated. And that means there's over 1 million residents left that haven't been vaccinated against COVID-19. California itself, around 74% vaccinated, I think 73.9. But there's still millions of individuals in the state who haven't been vaccinated, and there's millions of individuals across the US that haven't. And COVID's still here, it hasn't gone away, and hopefully it doesn't mutate and there's not a more contagious variant that arises. But as far as I see it, I think we're still in a pandemic, and I think it's just a matter of time before another surge.
Absolutely. I agree as well with Sam. We're obviously still in the midst of a pandemic. Biden came across a little bit sensational with that claim, but I think what he means by that in particular is kind of the spirit of where we are currently with the pandemic. We've seen a lot of folks in the World Health Organization specifically say we've been transitioning out of a pandemic into an endemic, which means that we're starting to become familiar with COVID in terms of our normal life, right? It's going to come to a point where COVID will essentially be synonymous with the common cold. Folks will continue to get vaccinated as these new boosters roll out. Obviously folks will wear masks at their own convenience. And the reality of the situation is that, it's not necessarily going to go away, but we're going to have to learn to live with it. And I think, just kind of looking at that spirit of the claim, it really addresses the fact that so much work has been done, by folks, in science, by folks, in medicine, by folks in the public health arena, where, we've seen so many folks do such diligent work. Our public health leaders are really heroes at this time and point. And we're seeing, a decline in terms of rates, whether it be death rates as well as that of case rates, in this country as a result of the hard work that's been put in, right? So, I agree with Biden in the fact that, we are coming to a point where it feels like the pandemic is ending, but the reality is, COVID is still alive and well in our own community, and we need to be sensitive to that, right? We need to be smart, because despite, the advances that we've seen, during the pandemic in terms of, the rollout of these vaccines, despite, the work that has been done to make sure that up-to-date information is out there for folks, we still see folks that are resistant to change in relation to getting vaccinated, getting their booster, right? I believe at this point in time, 67% of the nation is vaccinated, but half of that number have even gotten their boosters yet, right? So, the reality is there's so much hard work that needs to be done. And, I'm proud to have worked with Sam over the last few months to be on the ground, right? To be evangelists of, the movement for rapid recovery in our own community, right? By, really telling diligent stories around, what our health professionals are doing and how each of us can, be a part of that change, by doing the small stuff, right? By getting vaccinated, by wearing your mask, by upholding, the etiquette around social distancing, right? So feeling good, as numbers are declining, but the work is still ahead of us.
Yeah, definitely. I think you both made some really great points. One aspect that I think you both alluded to, and Jamie, you kind of expanded on this, was the community aspect. I know, Sam, you mentioned how a lot of residents in the San Bernardino area are still not fully vaccinated. From a community standpoint, and I know a lot of the work you both do involves, being hands-on, like Jamie mentioned, and being involved in the community. From a community standpoint, what do you think needs to be done, not just in the San Bernardino area, a region, I should say, but in general, should be done to actually, try and get more people vaccinated? Because, we've had the vaccine has been available for a while now. What do you attribute that to? Do you think that there are some other underlying issues that are preventing people from getting the vaccine? Is the message not getting across? Is it an education issue? What are your thoughts on that?
Absolutely.
Yeah,
I think that's an excellent question. And just to lead off, and I'll have Sam give the big finish. I think we've seen a proliferation of anti-science misinformation as well as disinformation in our community and across the nation. Right. We're living in a time where fear and anxiety have come up to such a point where folks have embedded what the truth is with conspiracy theories. And I think, in order to combat, what that really looks like, we need to, really come together as a community and wake people up the way we know how to, right? When it comes to, issues of civic engagement, when it comes to issues of, policy change and reform, when it comes to cultural moments where folks have had enough. Right. We resist with organizing. We resist, with being the boots on the ground, by talking to folks in our community, by, connecting them to what the truth really looks like. And I think what we've done with San Bernardino for Rapid Recovery is really kind of encapsulate ourselves with that idea by being the folks that are in the highways and byways, right, evangelizing, what the truth is around COVID-19 and what can folks really do. I think there are a variety of issues, right? Misinformation and disinformation are a part of it, right? There are also issues when it comes to transportation. There are also issues when it comes to, trust in public institutions. There are also issues when it comes to, cultural resistance, as a result of, historical advantages that the government has taken over communities of color in particular. So we're dealing with a cocktail of issues, and the reality is no one is responding the same way when it comes to receiving these updates. When it comes to learning about these things, right? And there are a variety of issues. I forgot the digital divide is also an issue as well when it comes to these things. So I think what is required of us, in this moment and of the moments that have preceded, today, is really being able to organize and come together, under the banner of COVID recovery, right? How do we recognize, what has happened to us, where we've been, and push forward to where we want to go, right? How do we wake folks up into the reality of what the truth is, right? How can folks get vaccinated? How can folks, get access to materials of information to check things for themselves, right? And I think a big part of what our community needs is a lot more of that. And we're seeing a variety of community organizations that have stood up to meet that challenge. We've seen investments and pushing kind of a community-backed public health and education campaign come from a lot of leaders, both elected and appointed, as well as community public health institutions in our community, really push that and invest in that kind of strategy.
Yeah, and jumping off that, San Bernardino is speaking specifically about San Bernardino. It's a very diverse community, and there's a lot of hesitation within historically marginalized communities. There's been longstanding distrust when it comes to vaccines and whatnot. And personally, for me, I think all of this is something that's helped increase vaccination rates in regions throughout America is community building and increasing trust in these communities. And I think it really all goes back to that, kind of touching on what Shamey's talking about. With San Bernardino for Rapid Recovery, of course, like at first, we're a new organization and community. It's hard to get individuals, residents to, kind of trust us at first. But as we began making a bigger presence in the community, we began seeing some positive results. And I think that, that just plays into it goes back to the importance of community building and trust. And I think that's something that's really needed to reach through to these individuals who haven't got vaccinated yet.
Absolutely. And just to add to that piece as well, it's about building a relationship, right? Like folks, during the pandemic have felt, isolated and alone. I remember back in the day where, it was me and my family huddled up against the TV, watching CNN to see what were the new updates and whatnot. And, I think as a result, folks have definitely, been sowed with seeds of discontent and mistrust. And it's up for community members like ourselves to, step up, right, to broker the conversations, right, to, spend time in the gap with folks and say, here is what we're hearing from our scientists or our trusted elected officials. Here's what we're hearing from the World Health Organization. Here's what we're hearing from, our county. And this is, how they're asking us to respond, right? And, folks often have, a lot of their own ideas, which is completely fine, right? But what we want to do is find a way to settle on the truth, right? Find a way to give folks enough information in their hand, to make the best decisions for themselves and for their family. So, San Bernardino for Rapid Recovery has been committed, to having those powerful conversations, right? To investing in community members that want to see that kind of thing happen, right? By, trying to be at the center of community spaces to have that type of discourse and to push that forward.
Definitely. And I love the way you both framed it, that it's a massive part of the solution is embedded in the idea of building relationships and those connections. And that's it's a critical aspect of it. Something that I thought of as you both were speaking, when it comes to, to education, when it comes to actually building those, those networks and giving people, the opportunity to actually learn, something that popped in my head was, and Shami, you briefly alluded to this, is the idea that there are divides that exist in the country, obviously, and one of the divides that I find really fascinating and really interesting to talk about is the divide that exists between Gen Z and millennials and older generations, specifically among the younger generation. What do you think social media and maybe media in general has done in terms of not being a trustworthy or accurate representation of what's actually going on in the world, especially as Gen Z and millennials, continue to, get older and be more involved in the country, and this, goes beyond just the United States. I find, I've seen much more conversation and much more discussion amongst the younger groups about, what's going on with COVID, what's going on with other, major issues that are affecting us. And, social media and media, tends to be more dominated by the younger generation, yet there's also a lot of misinformation, like Shami, you mentioned. And it seems like there's something missing to this piece. When you have, a younger generation that seems to be motivated, like on paper, you see the motivation, you see individuals, trying to make a difference, yet at the same time, you see so much of the misinformation. You see so much of, of negativity that's being spread. What are your thoughts on that divide that seems to exist? Or maybe I'm going totally in the wrong direction. Maybe it isn't as bad as the picture isn't as bad as I'm painting. Can you guys briefly talk about your experiences in that regard?
Yeah, I think misinformation is one of the most pressing issues in the US today. Like the polarization that's come from this, just blatantly false information online is threatened our democracy. It's helped made us lose millions of lives. It's helped COVID spread. It's definitely something that's been very dangerous to the United States, and not that it's just here localized in the US. It's a worldwide phenomenon. But this is something that speaking from experience, I've gone on Twitter before, I've gone on Facebook, and I've seen posts before, and they've looked true. Like that sometimes it can be very confusing whether or not what you're seeing online is false or not, and it's hard sometimes to fact check that. So I don't blame these individuals who are reading these fake posts and believing them, but you got to do some more fact checking when you're using these social media platforms. I think in terms of the COVID pandemic and misinformation spreading about that, there were like 7 or 8 social media pages that were responsible for posting most of the COVID misinformation online. It's these it was only a few bad actors that were able to, use their feeds and proliferate their misinformation online. And that's been something that's been, spread, caused people to not want to get vaccinated and not want to wear masks and take preventive measures to keep people safe from COVID. I think, while there are young people online who, are totally for getting vaccinated and wearing, PPE and whatever it may be, there's still a huge amount of people, individuals who are, as much as that's being posted and spread, there's so much misinformation that's being posted and spread as well. Personally, for me, I tend to see more misinformation when I'm on Twitter or Facebook. I think those are probably the most, like the biggest sites that I see misinformation on. And I think it has gotten a bit better since January 6th. I want to say, I think it's gotten a bit better since then, but it's still a huge issue. And really, like, you have like Truth Social now, or the 4chan, where you have QAnon and Trump, spouting nonsense. There's other sites now, but I think it's less mainstream. But at this point in time, the people who have already, kind of gone down the rabbit hole, or whatever you want to call it, they've kind of found their own communities now. And now it's just echo chambers, so.
Absolutely. And I agree with Sam. I think, misinformation has become such a serious issue, especially during the pandemic, more than we've seen before, right? We're, in the midst of, a life-threatening, virus that's proliferated across the globe, and folks are on TikTok and Twitter and Facebook, spreading lies, right? Even some of our favorite, entertainment personalities have taken very interesting positions, on getting vaccinated and whatnot, that often aren't in line with, public health guidelines, right? And I think, again, it comes back to how can we recognize, social media as a tool, and, see it as a double-edged sword, right? I think, obviously we've seen a lot of misinformation spewed, from a variety of sources. And I think with that, we have to obviously take things with a grain of salt, and always, try to, fact check as much as we can, and hopefully rely on these platforms to also try to moderate these kind of things to the best of their ability as well. And, kind of reference, the facts, or the so-called facts with what, again, our public health officials are saying. But also something I think that's kind of been amazing to me has just been, the amount of growth that we've seen from these sites in relation to, folks trying to, be transparent about what they're experiencing, right? Like, I'm sure all of us got that, random, Facebook post from a friend that we haven't seen forever, talking about, what it was like to have COVID at a point. And I think those moments were some of the most educational, where it was like, I'm sitting in fear, not knowing if I have COVID yet, or if I will get COVID, and what will it be like when I do get COVID. But by seeing so many folks step up and say, this is my experience, right? And I want you to try to be more conscientious, amongst this pandemic, was inspiring, right? And I also saw a variety of folks, who are, in positions, in the medical field, start to translate, these big, heavy documents to Twitter, to TikTok, to Facebook, putting it in a way that's more accessible for folks to be able to understand and interpret, right? So I think, again, we have to always look at things coming up on social media with a healthy level of skepticism. But, I do recognize the, innovative, features and momentum that's come from these platforms as a result of folks being, kind of united in the fact that we're all facing this together, right? And I hope that that kind of creativity, through these platforms will continue to move forward, as we get to the point where COVID, our rates continue to go lower and lower.
I was thinking about the question a bit more, and something I thought was interesting, or that I enjoyed seeing on social media. I'd say this past year, there's been plenty of ads while I'm on my feed to encouraging people to get vaccinated, to get tested and whatnot. And that was really good. I thought that was great. But one thing that worries me is, when we declare things such as the pandemic's over, and, we start seeing, potential decrease. I haven't seen as many ads as of late. I'm on social media pretty often. One of my jobs is working for USC Price's social media team, so I'm on social media quite a bit, and I've seen less ads over the past, few weeks, months. So, I'm worried, going back to earlier when we were talking about Biden, when he's talking about, oh, the pandemic's over. Well, if we're in that mindset, we're seeing less notifications, reminders to get vaccinated and stuff like that. It does worry me. And I think, social media can be a great tool to urge people to, like Shamie said, double-edged sword. It can be a great tool to get people to stay safe, protect their families and their communities, and it can also do the total opposite.
Definitely. And I love the way you both framed it, that in many ways it is a tool, and that, misinformation on its own is a topic that we can talk about for hours. But at this point, I want to shift and talk about San Bernardino for Rapid Recovery. Before we dive deep into it, I wanted to ask you both, what was your motivation for founding this nonprofit? What was the idea behind it? Can you give our audience a brief overview of how it even came to be in the first place?
Yeah, definitely. In February of 2021, I lost my father to COVID. It was a very hard time for me. I had been in Santa Cruz. I graduated UC Riverside 2020. I'd been in Santa Cruz that entire time during the pandemic. And my father was older. He was 75. And, I'd been careful. My whole family had been careful. My brother did work at a grocery store, and he had caught COVID. And unfortunately, it went through the whole family. And my father was sick for about a month, and unfortunately passed away February 17th, 2021. So, I had been wanting to do something about COVID since the pandemic started. I wasn't sure what exactly I could do, though. I was back home, just an individual. I didn't really feel like there was, I felt kind of powerless, honestly, and I hated feeling that way. And I knew, I had firsthand knowledge. I'd suffered from the pain and loss of losing, my dad. And so that kind of spurred me to want to make a change in a community and want to make a difference. And so, Shamie and I, very good friends. We go back to UCR days, and we've known each other for years. So we'd been talking about this, and we just decided, this is something that's feasible. We just got to workshop this idea, and we can turn it into something to help community members in need. And so, yeah, we focused on the Inland Empire. We focused on San Bernardino. Shamie's from San Bernardino. He can talk more about that, but that's kind of what we decided to begin. Yeah, SBRR.
And for me personally, growing up in San Bernardino, I've always, recognized the need that has been in the community for decades, right? We're a community that's has historically had a fight, with health inequities in the region, right? For so long, we've seen, a variety of rankings that have kind of painted the picture that, San Bernardino is a community, where, your health will suffer, right? At one point we had the third highest rate of heart disease, the county with the third highest heart disease, in the state of California. We were, the fourth highest county in the country for obesity, right? And during the pandemic, we saw that San Bernardino had the second highest mortality rate in the state of California, right? So living in a community like this, for most of your entire life, you recognize that, folks need support, folks need diligent action, folks need innovative strategy, and folks need folks, right? We need people. We need to, look at what is the road to recovery look like, and how can human intervention, really, change the landscape of how things are done and what the future looks like. And I remember a moment in particular where, we thought we had a COVID scare amongst us. I remember going to 4 different testing locations, and I wasn't able to find one adequately in San Bernardino. I remember driving all the way out to, I think it was I went to Redlands, and I went to Rialto, I ended up going out to Rancho Cucamonga and finally getting a test and just being so frustrated that I couldn't, have that same type of accessibility in my own community. And, during those times, I remember all of us, trying to, go to grocery stores, our local Rite Aids, and not even being able to find, a rapid test on the shelves, right? So I think as a result of that kind of that anger and frustration, I believe that we needed to build something that could really be tactitious in the way that we engage COVID. And Sam and I started talking, we started building, we started kind of connecting over our individual COVID stories, right? Which is really the power and the fuel that we do this work under. And we started looking at how can we really bring together the philosophies of street medicine, right? The passion and the grit of grassroots organizing, right? And how can we bring together the need for more sophisticated and community-centered healthcare delivery systems? How do we build that, right? And we had the privilege of talking to a variety of different organizations that are adjacent or in the space. And, coming together, we developed, a really interesting kind of pitch deck, and from there, we started talking to different organizations saying, how can we do this? How can we count on your support? Do you want to be involved in this? Can you support with funding? Right. And, after, diligent conversations, we were able to build something that, became, a real force for good in our area. And we're really proud of what we've been able to do so far.
I think one thing that really stood out to Shamie and I, he mentioned earlier, they had the second highest mortality rate in the state. But when we were looking at the case rate and death rate at the time, San Bernardino had maybe the fifth or sixth highest case rate in California, yet they were number 2 in deaths. And it really, looking at those numbers, we were like, okay, well, it has to be in this region. Like, there's obviously underlying factors here at play, inequity, these health issues that are just, San Bernardino is suffering, and I went to school, UC Riverside, right next door to San Bernardino. Shamie grew up there. We knew it was the right place to operate in.
Definitely. Thank you both so much for outlining that. It's an amazing story to hear, and the amount of work you've both put in is so admirable. I wanted to ask, can you both maybe outline some of the work you've done? Maybe some highlights, maybe your proudest moments in regards to SBRR?
Absolutely. I think also it's helpful to kind of define what SBRR is as an organization, right? Because San Bernardino for Rapid Recovery, right? What does that actually mean? So we essentially focus on vaccine equity and rapid health intervention through the lens of community. We bring together community members, elected officials, nonprofit organizations, and folks that care, to essentially be a part of a mutual aid approach, right, to spreading the proliferation of COVID information, right, community resources, and really being a part of pushing the stronger narrative that San Bernardino as a community has work to do as we try to push towards recovery, right? We're not just addressing the impacts of COVID, we're also looking at the historic health inequities in the community and trying to push towards a revival in that sense as well. So with our organization in particular, we've been focused a lot on COVID education. We do a lot of grassroots, movement building by being out, in communities in San Bernardino, talking to folks about things like, getting vaccinated, where can you get tested, where can you get, resources that are, needed during this critical time, right? Rent assistance, childcare, legal aid services, food insecurity resources, things like that. And we've, been a big part of pushing for, the free distribution of things like rapid tests, masks, hand sanitizers, food boxes for folks that are dealing with food insecurity as well. So we, have been diligently working on that, throughout the community, talking to folks, making beneficial partnerships to make that reality happen.
I think in terms of, that was a great explanation, Shamie. In terms of proudest moments, for me, at least, I'd say, we got the first grant we got to help fund our organization was from CORE. It was subgranted to us by CORE. It was in partnership with the California Department of Public Health and the CR Health Foundation. And we got nearly $250,000 to fund the operation, which was great. That was a huge moment for us. But I think that's one of my proudest moments. But the other one would have to be, at the end of the grant, we had about I want to say a 4 to 5 month grant operation period for that first grant. And we had goals. We had to meet a certain amount of people. I want to say around, probably in total, meeting around 12 to 15,000 individuals. But through, with our funding, through targeted radio ads, through door-to-door canvassing, being on the street, and through phone banking, we were able to reach approximately 215,000 residents in San Bernardino County. And so, we exceeded our expectations, which was great. That was close to, a 1-to-1, in like $1 for everyone individually, so that metric was really great for us. It's something that at the start, we were a little apprehensive. 15,000 that's a lot of individuals, but we were able to exceed that, and in some categories quadruple the numbers that we had set to meet. So I think that was what really made me proud of being a part of San Bernardino for Rapid Recovery.
Absolutely. And a lot of blood, sweat, and tears went into reaching that goal, right? It was, radio ads and the unique engagements we were able to receive from that. It was, the phone banking and the hours of, calling folks in the local community, again, letting them know about the resources in relation to testing and vaccination. It was also being on the ground and, going to a variety of different community locations. I'm talking Home Depots. We went to Stater Brothers, we went to, public parks, and we talked to so many people. And I think a big part of that, and I want to say thanks to, the team of folks we were able to hire from the community to help us in support of that goal. We had folks that came out every single day, and we were out in the community talking to folks, having powerful conversations and doing the work. And it was such a privilege to be able to hire folks locally, right, and invest again in the IE in terms of its workforce. A big thing that we also have been striving to do is, bring a diversity to the healthcare ecosystem, in this area, right? We want to see more people of color, on the road towards, becoming, folks in the medical field, right? Whether it be physicians, phlebotomists, nurses, folks, doing, different roles and whatnot, right? We want to help support folks growing who have that kind of interest, and give them the opportunity to kind of get some experience in that space. And, engaging in the public health arena is a big part of moving towards that kind of position for a lot of folks. So we're happy to have been able to do that via the grant that we received.
And another thing I wanted to highlight that I was proud of as well is, we were able to reach a lot of different communities in San Bernardino, and a lot of the ones that were really hurting from COVID. We were targeting, populations that had the lowest vaccination rates in San Bernardino. One thing that I was proud about, Shamie took the reins on this, he took the lead, but our barbershop visits is something that Shamie led, and I think he did a great job on that. I don't know if you wanted to explain that a little bit more.
Absolutely. So we had the privilege of partnering with the Riverside Black Chamber of Commerce. Shout out to everyone on that team. And we were able to, essentially build a team of, UC Riverside interns. And we, essentially did public health outreach again. And we went into local barbershops and beauty salons in San Bernardino in particular, and talked to folks about COVID resources, leaving, some of our literature, as well as, giving them other, promotional items, right? Things like, barber, I don't know what it's called, like barber, whatever barbers have, when they're giving folks cuts and whatnot, and, other things, right? Again, to start the conversation, right? And, that work really aimed to once establish initial, connection with local barbers, in the community, but to, grow towards actually throwing an event, in San Bernardino in particular, where we could essentially get folks vaccinated, tested, get them other, blood pressure checks, cholesterol testing, so other wellness as well, or other wellness testing in particular. And that was something that we've been able to do with them, which we're so incredibly proud of. And we've already hosted 3 events with the 4th one on the way as well. And we've, been able to bring so many folks, from a variety of different backgrounds to those events, and just, again, have that kind of larger conversation, not just about COVID, but about, COVID recovery as a whole, right? How do we get back to where we want to be, right? How do we pitch and draw a new line for what this community looks like in relation to its health and wellness?
And I want to say one last thing, just because I need to shout out UC Riverside. It was very uplifting to see the amount of support we had from the students, alumni of UC Riverside, local community colleges in San Bernardino, even USC. We had, volunteers our age from all over Southern California, the Inland Empire, coming out to help us. We had, fraternities on campus, UER, SAE, coming out to help on different weeks. We were engaging canvassing, and we're talking about canvassing in 90, 100 degree weather. It was, it's not the easiest thing. So it was really motivating and uplifting to see there were students like us who were willing to take time out of their weekend to help community members in San Bernardino.
It's so fantastic to hear this. Normally when I have conversations about COVID-19, there's such a negative undertone. Understandably, there's such a negative undertone, but it's so amazing to hear you both talk about SBRR and the amount of work you've put in. Your story is just so inspirational. It makes me want to get up and do something right now.
Come on, volunteer.
We're gonna put the for our audience, we're gonna put all the information about SBRR in our show notes so they have access to everything. We are approaching the end of the episode, so I did have one more question I wanted to ask. Looking in the future, and this could be about SBRR or other things you may be working on. Is there anything that's you're looking forward to for the rest of this year? Anything that's exciting that you want to talk about briefly?
Yeah, if you look in back of Shamey, you'll see some white boxes. Those are our rapid recovery kits. We are rolling them out as we speak. We're in the process. We're going out canvassing and whatnot, and talking to residents who are in need. And we have boxes prepared for community members, including PPE, rapid tests, hand sanitizer, and educational pamphlets, free of charge. We just started putting these together. We finally have all the materials, and we're getting ready to roll them out. So that's something I am very excited about.
Yeah, I'm excited to just keep doing the work. I think what is happening in San Bernardino in particular, and in the IE as it extends, is a revival, right? I think a lot of folks in the IE can relate to sometimes, feeling like we're living in an environment that doesn't have the kind of resources that places like Los Angeles or San Diego or the Bay Area has, right? But we matter just as much, right? And I think, with the work and the momentum of Sam and I and the other folks that have been able to support us and will continue to support us, I think, there's an opportunity here to, again, keep pushing for a stronger San Bernardino, right? Where we're investing more in health and wellness. We're investing more, in the talent that the IE has in relation to pursuing, field opportunities in the field of medicine and science, right? In the field of innovation, when it comes to, thinking about how do we really respond to things like this, in the future, right? I think a big part of why we were hit so hard is because San Bernardino was not prepared, right? And, we really want to focus not just on COVID again, but, on the larger health inequities that have plagued this region for some time now. So, we're looking forward to, continuing the fight. The marathon continues, and we're super excited to engage UCR more with our work. And we're grateful for this opportunity as well.
Thank you both so much. I love ending on a positive note. Thank you, Sam. Thank you, Shamey, for taking the time to join us on the final summer episode of Policy Chats. It was amazing to have you both on.
Thank you so much for having us, Kevin.
Thanks so much, Kevin.